Well, good morning, everyone, and welcome to Ottawa West Nepean. It's a bit of a rainy day here today, but we're here to share some truly tremendous news, both for Ottawa West Nepean and for the City of Ottawa as a whole. I'd like to start by thanking Cam MacLeod, the Executive Director here at the Carlington Health Centre, for welcoming us this morning. And Cam really is a visionary, and I'm going to speak about that in a moment. But of course, also want to thank all of my MPP colleagues and who are here today. Minister MacLeod, who of course is dealing with one of the most challenging files during this pandemic, helping the hard-hit tourism and culture sector get through this pandemic. And I know that Minister MacLeod is relentless in her advocacy for that sector and making sure it can emerge even stronger once we're through this pandemic. Of course, my colleague to the west, Minister Fullerton, who again, a tremendously difficult portfolio to navigate, our long-term care file, and making sure that we are getting beds built and making sure that our long-term care residents are protected. And of course, Minister Fullerton was recently able to announce some very good news for Ottawa West Nepean. We are getting almost 400 new long-term care beds here in Ottawa West Nepean, which is going to be a real game changer here in our riding. And of course, our very special guest here today, the Minister of Finance and President of the Treasury Board, my friend Minister Peter Bethlenfalvy, is here with us today. And Minister Bethlenfalvy was last here in Ottawa West Nepean just over a year ago. It was actually the day before the pandemic began. And at the time, he was our tireless President of the Treasury Board. And I don't think any of us really knew what was coming in terms of the significant challenges that COVID-19 would present us. But over the course of the pandemic, in his role as President of the Treasury Board and then as Minister of Finance, Minister Bethlenfalvy has risen to the challenge and made sure that we are spending the investments, making the investments where it is needed most for the people of Ontario and for the people here in Ottawa. This week, Minister Bethlenfalvy presented his 2021 budget, and this budget was centered on two key priorities: protecting our economy and protecting our healthcare system. And of course, as Minister Bethlenfalvy rightly noted in his budget speech, we can't have a strong economy without a strong healthcare system, without a healthy people. And that's what we're here to celebrate today, some of those investments in healthcare right here in Ottawa. Our budget, of course, included significant investments in all of our hospitals right across the City of Ottawa to ensure that they have the capacity to meet the challenges ahead. But we also have some really special announcements, and I'd like to start with one of those. During the budget consultation process, I had the chance to meet with Minister Bethlenfalvy several times to talk about a project truly important to me, which is CHEO's new One Door for Care unit, a project that will bring together a number of special needs, developmental services, and rehabilitation care that are spread out across Ottawa and bring them together on the CHEO campus in a brand new hub. And Minister Bethlenfalvy is not only extremely well briefed in the financial matters of this province, but he also has a tremendous, tremendous heart. And in painting that picture of what CHEO's One Door for Care would mean for our community in Ottawa, CHEO, for CHEO and for the 40,000 families that rely on it, Minister Bethlenfalvy saw that vision. And this week in our budget, we fully funded the CHEO One Door for Care project, which is tremendous, tremendous news for the people across Ottawa. And lastly, we come to where we are today at the Carlington Health Centre. And I mentioned earlier that Cam MacLeod is a visionary. And when I came here to the Carlington Health Centre shortly after I was elected back in 2018, Minister MacLeod and I joined Cam to open the facility that we're standing in, the top floors, which was a multi-use seniors complex that was going to be networked in to this health centre. And Cam walked us through the upstairs floor, showed us the room, showed us how this was going to make life easier for some of our low-income, vulnerable seniors. And then he took the time to walk us through this bottom floor, which was gravel at the time, and painted a picture, a vision of what this could be for our community. And it is so tremendously exciting to be here today and to see what that vision has evolved into now that this community health centre has come together. There's still more work to be done. The building next door, the school building that is the original Carlington Health Centre, is still undergoing renovations, and I look forward to coming back with Cam and perhaps some of my other colleagues to see that building come together into what it is going to be. But again, the vision here at Carlington Community Health Centre is meeting the needs of our vulnerable populations here in Ottawa West Nepean, and doing a tremendous job. And so I would just like to conclude by thanking each and every one of the staff here at the Carlington Community Health Centre for all the work that they have been doing throughout the pandemic to respond to this crisis. We couldn't do it without you, and we're so glad that we can be here today as representatives of Premier Ford's Ontario government to make investments to support our healthcare system here in Ottawa. Thank you, everyone.